Hello and welcome to Live with Hillsdale Hospital. We always have that delay, Randy. And it's always, when you start, when you talk. All right, I'll get some better cue cards. But we're going to talk about you in a minute. But I'd like to welcome our guest today to Hillsdale Hospital Live. And we're here to talk to you about all the happenings right here in healthcare in Hillsdale County. What's impacting you, what's impacting your family, new services that we're expanding. Great opportunity to talk about 2025 in just a minute. Now, you were on recently talking about some of the challenges around influenza, and every year we seem to bring you in here to talk about it because you're in fact, I would say about a month ago, and we have probably one of our highest ratings. Yes, isn't that hard to believe? And I know you wanted me to mention that. So,
I did.
Yes, you did. But Randy Holland is my guest today, and he is joining me in the studio to talk about those issues which face us every year. It seems like October, November, December, Randy.
Yep.
Influenza, increase in COVID pneumonia. I want to talk a little bit today. We had the health department on last week talking about some of the challenges that they see really, in a statewide issue in their region. I want to talk specifically about Hillsdale Hospital. We've recently changed some of the rules about accessing certain departments. You made all those rules up. And so we have to talk about why you made those rules, because I don't want you mad at me. Okay, he did it. Reason why we had to do it, prevent the spread of infection. So at the end of the day, we can keep our community safe, our patients safe, our little babies safe. That's so important. And I would just like for you to introduce, for those 2 or 3 people out there who may not know who you are, talk to us about your background, where you came out of, and what you're doing now for us.
I came out of my mother's womb. Oh, wait. And I went, Anyway, so I have been at Hillsdale Hospital for a very long time. For those of you
How many
that
years?
don't know, 2002.
20
was the first
years.
year of
I'm good at math.
my
23 years.
engagement at Hillsdale Hospital.
Nice.
Started out as a nurse's aide. Worked my way through nursing school.
TAP was it called, right?
It was called TAP back then.
Technical.
Advanced personnel.
All right. So it's crossed between really like a CNA and a nurse.
We were EMT.
You were EMT medics, right?
Yeah.
So that program itself is what, a year?
It was 6 months, I believe,
6
the
months.
EMT.
So you got 6 months EMT?
Yep.
You
and
came
then
out?
we did got our CNA license, did a couple classes through Jackson Community College, like body structure and function. So we were understanding things, medical terminology.
Yeah.
Because in those days, everything was written. So we had to be able to. No
computers back then, Randy?
No.
Yeah.
Had to be able to read the physician's writing, write orders.
And you had great trainers like Pam Wilmer and some of those characters who used to walk the hallways here and really trained you in healthcare, how to become good healthcare providers and giving that care to someone who needs it the most.
And I think that art, as Pam had, and I mean, we still have Doris here, who was the same way, and training the young.
Right.
So we've kind of, unfortunately, lost that art as the
industry changes.
Changes, people retire. But then graduated from nursing school, went into infection control here as an infection control nurse.
Talk to us about what infection control means. I mean, like, that encompasses a lot. There's employee health, there's patient, there's the facility itself with skilled nursing. There's a lot of dynamics. Talk to our listeners a little bit about what that means.
So employee health, correct. So I track all of employee illnesses, instrumental in new hires. So we do a drug screen, have to make sure that their immunizations, they're up to date or they've signed the waiver. If they're not up to date, make sure that they don't have TB, communicable diseases. Employee health as well, have to track annually and report to the government our vaccination rates for COVID, influenza, that. Keep track of like hepatitis B and Tdap.
So you're reporting all of these things, most of these things, to the government.
Yeah,
because they keep a record and a track.
for our
Yeah.
reimbursement.
Correct. Yeah.
So all of that is employee health. For inpatient side, I have to track all of our Foley catheters, our central lines, our vent patients to be sure they're not acquiring infections here. All of that I have to report monthly to the government. Weekly, I have to report our vaccination rates for COVID, for hospital and skilled nursing. So those are separated in the reporting system,
and don't you
and
think
they're
those are
separated in the way the requirements,
the way they flow?
So they're what's good for the hospital is not necessarily good for skilled nursing. So, for instance, if we limit visitation or start masking or anything like that, just because the hospital side is doing it does not mean the skilled nursing side is doing
Sure.
it. Their requirements are CMS requirements and state of Michigan requirements. So that's all different. So sometimes theirs could be stricter than ours, or ours could be stricter than theirs, depending.
Yeah.
So sometimes that's a little confusing for
Well,
people.
with the new aggressive monitoring of our skilled
Right.
nursing facilities across the country, I think that this reporting is certainly not going to go away. Some reporting has, though, some COVID reporting, and I think they're going to retire some of those potentially into the future.
They're talking about it, but they're adding other types of
okay.
reporting
Okay.
to
To replace, of course they are. Absolutely. So let's talk about reporting. So influenza season varies from year to year. Sometimes there's a strain that just takes out a lot of people,
Right.
down and out. Other strains maybe are not as viral and serious. Patients aren't as acute. So tell us what's happening around our community. When I say our community, Hillsdale County, what are you seeing? What are you experiencing? What are we seeing on the inpatient side? Maybe even on our skilled nursing facility side?
So our county, from the rates that I see, are positive tests that come through our lab. So any outpatients that are tested for COVID, RSV, we do a respiratory panel that physicians order. We have a fourplex, what we call it. So it tests for influenza A, B, COVID, and RSV. We do that test in-house in our lab here. So
what's the turnaround time on that, Randy? Usually.
The in-house, that takes 40 minutes.
Okay.
But it depends on if all three machines are in use. Within an hour.
So they're getting back
an hour and a half. Yeah, within a couple hours.
Okay.
So most of those are used by our physicians on the floor. If they're testing the inpatients, it's used pre-op for surgeries. It's used the majority.
Mhm.
And a lot of ER patients. So any ER testing that's done usually is 99% of the time is that.
Okay.
So those numbers over the last, I want to say 5 weeks, have continuously increased across the board. So ER patients, outpatients with the respiratory panel, inpatients, SNF, and it's not just one this year. Like last year, they talked about the trifecta of COVID, RSV, flu.
We're going to get to
Well, it kind of all goes together. So it really wasn't that horrible last year.
Yeah.
This year, from what I'm seeing in our area, it is a lot more of the mixture. Like there's a lot more RSV this year at this time for the season than I remember seeing last year. Influenza, not so much. COVID just started ticking up again the last week or so.
Yeah.
So it's a variety.
Okay. So let's talk a little bit about that, because I've had people tell me I think I have COVID.
Right.
And I've had people tell me it's definitely not COVID.
Right.
I've had COVID before. All right, what is the difference between the flu, COVID, pneumonia, and symptoms, and maybe even looking at how do we treat that? And the second part of that question is there a window that we need to identify in all of these in order to treat them?
So RSV, we'll start with that one.
Okay.
Is the newest that has a vaccination.
All right.
It's not approved, so insurance doesn't pay for most people to get the RSV vaccination.
Okay.
So
who does it primarily impact in terms of
it
attack?
used to be
Children,
just
right?
like very young children and very old people. it's across the board.
So it's no longer
I'm
restricted.
seeing
Okay.
20-year-olds,
Okay.
30-year-olds. The treatment for that is just supportive. There's no specific. There's not. So like for flu, you have Tamiflu. For COVID, you have Paxlovid.
Yep.
So within 48 hours of flu or COVID, you need to start those treatments for it to be effective. And it's
Upon onset of symptom.
yes,
Okay.
and it's one of those that it's supposed to lessen the length of time that you're sick or lessen the severity of your symptoms. It does not get rid of the flu or COVID for
Okay.
you. It just helps your symptoms. So those, as far as what I'm hearing this year, because I haven't been sick with any of them this year. I've had them all.
You know,
years
COVID like
past,
7 times.
I really have.
Yeah.
I've had RSV. I've had influenza. They're all kind of about the same in the way that their symptoms start out, from what I'm hearing. From what I've heard, the RSV seems to be more severe for people respiratory wise.
Okay.
And from my experience of all three, I would agree.
You know, Raina, one of the things I'm noticing is that testing is not as high and frequent as previous years. And is that because people are just saying, I'm sick?
And it pretty much is. There are quite a few people that are, I'm sick, and I'll just stay home if I'm running a fever, which is the recommendation.
Yeah.
Or a lot of the testing doesn't get reported because everybody has availability for the rapid testing at home.
True.
I don't know. I have not
the
rapid testing for RSV, but I know that you can for COVID or flu.
Okay.
So that's available, and everybody or a lot of people just go by the test if they're that concerned about it.
Yeah.
But I believe a lot are just, well, I mean, I really am not going to do anything unless I'm bad. So I'll just stay home, take care of my symptoms. And
so let's talk about the rising rates. So you've noticed a pattern, right? What steps are you taking to safeguard the hospital? We'll talk about that first, and then we'll talk about the community. But when you start seeing those alarming numbers that cause you concern, what are we doing as a hospital to mitigate some of that?
So when I start to see the numbers rise, I send out emails, like all user emails, just saying, hey, just a reminder. Numbers are going up. Just a reminder, if you have symptoms, wear a mask if you're at work. It's recommended that you wear a mask at work.
Yeah.
If you're sick, stay home. If you're running a fever, it is our policy that you cannot work. If you've ran a fever of 100 or greater, you can't work for 24 hours until your fever's gone. So that's how I generally start the process.
Sure.
It's just reminders.
Okay. So internally, we're working all of that. But when you see those numbers increase, it has some impact on our units. Talk a little bit about restrictions and why we impose them and what's imposed right now.
So for our skilled nursing, the last that I've seen, we really can't implement restrictions for skilled nursing anymore. We can strongly recommend or require people to wear masks, but we cannot limit visitation any longer for that.
And that came out of the fact that during COVID, skilled nursing facilities were restricting. Patients were dying.
Because
loved ones couldn't. They had
that was the requirement.
And actually, it was mandated by many of the governors across the country. Unfortunately, what that created is an environment where loved ones could not gather with their patient, and they died. And there was a lot of, disconnect between the families. And so I think we're now heavily guarded that they have a right, and you want them to be around their family. But we also have to recognize that as a a family member of a patient, I also have to be cognizant of, if I'm sick, I really shouldn't be coming in to see grandma, because if I infect grandma, she's going to be then going into the dining room with 40 other people. And that's how we spread it. So while we can't say that we can put the restrictions on, we can, heavily suggest that if you're feeling sick and you have to visit, wear a mask.
And it should be that way. I mean, that should just be common sense at this point.
Right. Talk to us about obstetrics, because that's another area that's impacted by increased flu and or COVID rates.
Right. So when I see the rates start to go up, we have a policy in place for when hospital will restrict visitors or go to universal masking, regardless of vaccination status for employees, visitors, such as that.
Mhm.
So there is a percentage of our inpatients that have to be positive, as well as our patient or employees that have to be positive at the same time, as well as a certain rate in the
It's a
community.
percentage, right?
So all of that combines together to determine.
Right.
So kind of the same applies to OB, but it's a little stricter because we're dealing with newborns
Yeah.
that have very little,
Low. Very low.
Oh, tolerance.
Yeah.
They have no immunity. Whatever mom's got,
Low
it's
to
like
no. Right.
Tdap or
Yeah.
if the mom gets that during pregnancy, they have some immunity for whooping cough. But so that's a little tighter. So when I start to see a 20 or 30% increase in especially RSV, which targets the young, I mean, that's
Yeah.
always been the main
Right.
one that you think of when you think RSV. Then I start to get concerned, starts to get a little higher than that. Then I reach out to our OB docs, I reach out to our pediatrician, our OB manager, and we email discuss.
Sure.
I think it's time that we limit visitation,
Yeah.
recommend masks
To stop the
because
spread.
I'm seeing a higher rate.
Yeah.
And then they weigh in, and based on that, we decide whether or not we're going to.
Yeah.
And that's where we're at right now with our OB is the RSV that I'm seeing, and that is just the ones that are tested through our lab. There are twice as many already this week than there were last week. So I believe it was a good decision to put this in place already this week. So that's how we get to the decision to do restrictions.
To put the restrictions. When do you lift the restrictions?
When I start to see a considerable decrease. So, and
Over time.
more than 1 week.
Right,
So I judge, and we generally reconvene after a month and talk about what are the rates now, because it can fluctuate a little bit every week, but if you see steadily over 2 to 3 weeks that it's declining considerably, then you are more apt to believe that it is starting to wane a little bit in our area.
So, I don't want to insult anybody's intelligence as it comes around, to terms of how do we handle precautions during these seasons. But I think it is important to have the discussion. So we're doing it only as information sharing. And there's simple steps that we can all take.
That is.
You don't touch your hands to your face. You wash your hands.
Wash your hands.
Talk to us about what steps can we take?
So the first, if you don't feel well, just don't go out, and if you have to go out, wear a mask, or
if you're sick,
if you're sick, if you don't feel well, at least stay away from people that are older or very young that could possibly not do well if they were to get sick. Wash your hands often. Cough and sneeze into your elbow. Hand sanitizer when you're out in public, especially like touching gas pumps or just little various times while you're out in public, use hand sanitizer so it breaks it a little bit. So
handle on the coolers when you get your pop out. Those are things that we don't think about, but as that sick person comes in to get their Gatorade and they open that door and you go right up and you open the door to get your soda pop out, you've now go out to your car, you touch your face, and now this is how we have the spread. We're not saying stay home. We're not saying that you can't go out. We're saying is use precautions if you have to. If you don't have to, stay in. Recover.
Employers and it's cold. Why would you want to go out anyway?
But employers now know that people are sick, that we want you to stay home.
Right.
It used to be, push through, you know, you can come to work. But now everyone's like, okay, we don't want the spread around the campus or our workplace. So the other area, immune compromised people, it's important for them to wear that mask.
Right.
We can't mask shame. Pre-COVID, people were wearing masks. We've worn masks for 100 years at this
Right.
hospital to prevent the spread of disease. We know that it is a way to slow down, but there are many in our community pre-COVID who were wearing masks because they're
Yeah.
immune compromised. In other words, they still have to shop at Walmart
Right.
and Market House and all those places, but they want to take some precautions. So be considerate and kind when we think about those things. That as our illness may just not be that bad. We might think, oh, I can labor through it, but I got the sore throat and I don't feel good, but I got to go to the store. Consider maybe it's your grandmother who's in that store or immune
Right.
compromised. The other area is, small infants, and until I became a grandpa, and you told me it was a great thing, Randy. Now you're a great grandpa, right?
Yeah.
I'm just a grandpa. So it naturally makes you older, right?
Yeah.
And so for my grandchild and now children, it's you have a different perspective
You do.
because it's like, okay, we got to safeguard these little guys, right?
And more so for your grandchildren than your
Oh, and your
children.
children, yeah,
Yeah.
they were eating
They'll get
worms
over
and
it.
dirt
Yeah.
and stuff. They'll get over it. But your grandchildren, you want to
Exactly.
safeguard those children. So with that, their immune systems are not built up, and we would just simply caution, you moms and dads who are new moms and dads, just give consideration. Maybe one stays in the car while the other one runs into the grocery store, or maybe you lessen your frequent trips during the flu season. You have a child during flu season to the, eating out
Right.
and those type of things. Just remember that little type there is, not you, but all of that, all those children are impacted by the community germs, and the inability to fight it off
Right.
with an immune system can create significant setbacks for those little kids. That's so important. And
RSV is very, very rough.
Yeah.
On very young children.
Yeah. If you are also an individual that loves to kiss little kids,
Yeah.
because
It's very difficult.
It's very difficult. But understand, even your own grandchildren or children,
Yeah.
the reality of it is that's the biggest cause right now of our spread is that Junior, all right, and parents that have hand sanitizer, and I never why did they do that? We now know why we do that, and that's before Auntie picks up the baby. Use the hand sanitizer because Auntie has just been out in about. So all of those things are steps that our community can take each and every day to safeguard themselves, their children, their grandchildren, and our community in general. One last question, Randy. So take all that stuff aside. Talk to us about infection prevention in general. I'm not talking about just the flu or COVID, but prevention in the hospital. You've been doing this now for a long time. Give us an example of what types of steps we would take, pre-surgery, post-surgery, whatever it is, to prevent the spread of disease or those types of things.
So there are some pre-surgery, depending on the surgery, we will test them to see if they have MRSA. If they do,
and MRSA, so our audience knows,
is methicillin-resistant Staph aureus. So it means it's.
I was going to say that, but I wanted to.
It's organism that's resistant to certain antibiotics. So you hear a lot in the public now about multi-drug resistant organisms and how antibiotics are becoming less effective. Yeah. So that's one of them.
Yeah.
So we test certain surgery types for that, depending on the severity of the classification of the surgery, type of surgery. A lot more like our joint surgeries, or more what we consider a clean surgery, that we don't want them to have complications post-surgery.
Right.
So we are testing for those surgeries. They do chlorhexidine baths, so it's a special soap that they bathe with the night before
in advance. Yeah, and their primary care or their surgeon's going to talk to them about this, right?
All of that
PAT,
is
the
talked to
pre-admission testing
prior to surgery.
Right, but it's to safeguard.
Yeah, it is.
Stop the spread.
And then we have certain cleaning in place in the ORs. So after each case, it's cleaned a certain way so that something's not transmitted. The airflow in the rooms is a certain way so that things do not come into the OR from outside the OR.
And those are mitigation tools that we use that are very expensive.
Yeah.
but some are mechanical in nature,
Right.
not just human,
Right.
but mechanical filtration systems
Yeah.
to safeguard our patients.
So those are behind the scene things that is required, but is able to help. Like the staff in surgery come in and change into scrubs that are laundered here,
Correct.
so they don't come in from outside.
Right.
Little things like that. And then we attempt to separate them if they're admitted, to a certain area on our inpatient side away from people that are infectious.
Right.
So that for any reason, they won't get something while they're here.
Correct.
So not always works out that way, depending on how busy we are, but that's our goal.
Yeah.
We don't leave appliances in like Foley catheters, central lines any longer than we have to, so that the longer those in, the chances are you get infections from those.
And now we're testing before surgery. We don't do that all the time, but during these periods of high intake.
For anybody that's going to be an inpatient,
right, they get tested.
We do test for COVID, flu, RSV.
So let's say it's a scheduled surgery. Mm-hmm. We know that they're going to have to recover post-op at the hospital for at least a day.
Yep.
We're testing them. If they fall out, surgery's canceled.
Not necessarily.
Okay.
We can still do the surgery if they choose to do the surgery. They are just bumped back to the end of the day, so they'll have a mask on. They'll immediately put a mask on.
Right.
But you're the last case in that particular operating room. So we have more than one operating room. So when I say end of the day, I don't mean necessarily that it's like 5 o'clock at night.
Right. Or midnight.
So end of day could be 1 o'clock and it's the last case in this operating room. Then you would go there so that they could do even further cleaning of that room and the equipment before they would have to do another patient.
Yeah.
So technically the next day before they do another patient, to be sure that there's nothing hanging around that would cause an infection for the next patient.
So then we have all that going on. Take precautions.
But that is always between the surgeon and the patient.
And really, if you're a patient and you have COVID, you really don't want to have the surgery per se if it's a tough recovery, right? Because I mean, you're already sick, you're not feeling well, then you're complicating it with that. But it's an individual choice, right?
It is. And if you're being intubated for the surgery, which most lengthy surgeries are, your chances of developing pneumonia after the surgery because you have COVID,
very important,
which is a difficult thing after surgery anyway. All those risks are higher.
So last question, Randy, before we open it up to anybody that may have live questions. You also are dealing with some unpleasant things, such as you deal with bed bugs, you deal with lice, you deal with all those things as well.
You got those taken care of.
I just talking about them, I start itching. Okay, but we do deal with that.
Right.
We do deal with it because we have a population, unfortunately, at times where individuals just can't get the treatment care they need, and so they present. Some of them may not know that they have it. Others just, unfortunately, they do not have the wherewithal to correct those things. So they come in.
Not a dirty person.
No.
But that is generally the thought of the public. If you hear bed bug or I mean, anybody that's had kids in school, it don't matter.
Lice.
Head lice at some point during the school year. Your kid's going to come home with it.
Social economics
and
have nothing to do with it.
And if you have a kid that's a teacher, they're going to freak out.
Correct.
Because all their little kids have head lice at school.
Yep.
So it's neither one of those are a dirty environment necessarily.
Right.
So head lice are much easier to get rid of than bed bugs. I mean, shave your head, and that's easy.
It's easy for you to say that, but Randy, that's not easy.
So no, you nitpick them, and I mean,
it's a lot of work.
85% of us all have done that at some point in our life.
But
sure,
your solution is just shave the head.
Shave the head.
Okay.
And then you bag everything up for a month, and you're good.
Okay.
Bed bugs, however, don't tend to go away. So the biggest thing with them is they feed on your skin, they feed on your blood. So you have bites, you itch. They're not considered a risk by the health department
For public safety.
for public safety
Yeah.
because they do not carry diseases from one person to another. So that makes it very difficult for people to get help
Yeah.
with treating their homes because it's very expensive.
Oh, it's very
You
expensive.
have to
Yeah.
basically heat up
Fumigate.
the whole house
And
to
costly, very costly.
this astronomical
Yeah.
heat.
Yeah, and you can't. I mean, there
Yeah.
are self kits that you can purchase,
But
but
it does not
typically
get rid
you
of
have
that.
to bring in professionals.
You do, and it's very expensive.
Very expensive.
The self things will do a little bit to
Yeah.
regress them,
Yeah.
maybe push them to one other area that you don't notice for a while
Yeah.
and make them not come out.
Right.
But
we often deal with that.
We
And
do.
then there are resources that we, discharge planning, can provide families post-discharge if there's an environment that needs that help. And there's resources that we do provide. We don't do it, but we can say, here's a community benefit. This is a company that can do it, and those type of things. Because
there aren't many of those.
Yeah.
So it is
very few.
Very few.
Yeah.
And a lot. And they will do the best they can and give you all the information they can, but it is very extensive for our case managers.
Right.
When
it is.
we go to that because there are so few resources for
to
that.
try to find it for
Yes.
somebody. So,
But
Randy,
we do our best.
we do, and you do a great job here. I know I always
Thank
give
you.
you a hard time, but we have, obviously low infection rates. We're doing a great job at safeguarding our community, and not everybody likes it when we have to say grandparents are limited to seeing the grandbaby at a delivery, or that aunties and uncles can't come in. But we're doing that to safeguard our loved ones, our community, and those that are immune compromised. And I think that's very important. And you weigh that very, very seriously.
I do.
And it's very heavy on you. And I appreciate the work that you do here.
I mean, imagine my wife, our latest great grandchild. She wasn't there. They wanted her there because she was coughing. She's like, I'm not doing it. And she was distraught because she's a smoocher mama.
Yeah, right.
Like you're going to snuggle and smooch on every little baby that you come across. Yeah.
Right. Yeah.
But it was difficult, but
tough.
She stayed away.
Yeah. She did the right thing.
Felt better.
She did the right thing.
It was the right thing, but it's very difficult
but it is
to
hard.
make that decision.
Yeah. Well, you heard it today, folks. One of the best ways that you can safeguard yourself is to get vaccinated with the flu shot. And that is one mechanism that you can use. We also think about that time of year where it's vaccination for flu, vaccination for COVID. There's access to other vaccinations as well. Give that some consideration. But if you're saying, nope, not doing the vaccination, then take the precautions, the mask, if you're sick, if you have to go out. If not, stay in. You'll get better in a few days, and the community continues to move forward. Employers are not at risk of losing employees, and then the production rates go down, and all the challenges associated with losing labor in the workforce. So thank you for joining us today. Are there any questions live today? No. Now, what I want to make a note of is that usually, and Kirsten can correct me here, but thousands of people view our videos. I think upwards of even 10,000 or greater at times. So she said yes. I just want to make sure she's holding me accountable. And many times we would just encourage you, because we don't get a lot of live watchers. Right. They watch it after the episode. Put your comments in the comment box. We will respond to you. Just because it's not real live, the experts, she'll send Randy an email. Whoever's monitoring that will send it to the appropriate person, and we'll get your question answered for you.
Yes, Kirsten will text me at midnight tonight.
Yes,
and say,
I usually text Randy and say,
someone
asked the question, and Randy will usually give a very sarcastic response, and then he'll correct that with another sarcastic response. Always. And then we get to the heart of the issue. But anyway, please put your comments in the comment box, and we will see those. I promise you we'll read them. We thank you for joining us today. Your commitment to our hospital is what creates the environment that we're in today to provide rural healthcare to you. When you use our services, we generate the services at the hospital. We can keep people employed. We keep our health system moving forward. So when you think about, you know what, I can get that service somewhere else, why not Hillsdale? Why not get those services in your backyard? We encourage you to do that. If there's a service that you don't know that we have, check our website out. Call the switchboard and say, do you offer this? We will redirect any of your questions to the appropriate person so we can answer it. I also want to remind you that the community needs assessment is so important. It is going to expire on February 14th. So we're a little, than a month away. And your response to that assessment is so important, because this is how we drive organizational change to create new programs. We brought wound care here because of it. We brought infusion back because of it. We've had PET scans here because of it.
Need about 500 more.
Yeah.
To reach our goal.
So about 500 more responses. Month out, I think we're at about 4 or 5 right now. We like to get over 1,000 because we want a good sample. We just don't want a few. And so what you tell us there is the truth of what you're looking for in your healthcare. So that's very important. If you want a voice, fill out the form. You're anonymous, so you can put any of the requests that you have on that. And then there's other ways that you can engage with us. So maybe you're looking for a job. We're in a statewide and national award-winning organization. Go to our website, hillsdalehospital.com, under the careers tab, and you can find roughly 30 plus jobs today that are posted. Many of those entry-level jobs that can lead to, Randy was a TAP professional, and now he's one of our administrators. The opportunities are endless of what we can do to support you as a community member to achieve great goals that you have. Maybe it's you want to be a nurse someday, or you want to go into the medical field, become a nurse practitioner or a CRNA. We will sponsor you over time for the education and the training that you're seeking to better yourself and to give back to our community. Giving back to your community, you can volunteer. Randy is the administrator of our volunteers, great group of people.
Yeah, it is.
But Randy, it's diminishing.
It is.
That group is.
There are many that say they want to, but then when it comes down to actually coming in,
It's a lot of work.
It is a lot of work. And it is the same small group that I see consistently.
Yeah, but we got to grow it.
So
we got to grow
keep it viable for the future. Yes,
we have to grow it. So I would encourage you to apply if you're interested in volunteering. Maybe you've retired recently. Maybe kids are just out of the house. You're like, I want to do something. We have plenty of opportunity.
And you don't have to be a certain age to volunteer.
Oh no, my goodness.
If you're just looking for something other to do, they welcome anybody, young and old.
Absolutely. Check out our website. You'll find their opportunities to serve, opportunities to recognize individuals that are in healthcare, opportunities to work here in healthcare, and opportunities to give. Our capital campaign is wrapping up here. $1 million goal. We'd love to hear from you. Unfortunately, the year-end contributions would have had to been made by December 31st, but start off the new year right. Make a donation to this hospital, which will go for programs like Randy's just discussed, programs in our obstetrics, in the community, the work that we do and engagement. Those programs are propped up because of your support. Consider making a contribution if you would today. We'd love to hear from you in any of our forums. We'd love for you to join us on our live every week here. Find it. Review the session after we're done. You don't have to attend live. Comment on it, forward it, like it, do all the things that you can do to promote this to our community so that we can provide these programs from now until a very long time, as long as we keep our community healthy. And so we would ask to join us also on our weekly radio program, WCSR 92.1 every Friday, and then Buzz 102.5 every Saturday, where you can learn about what's happening in healthcare right here in Hillsdale County. So until next week, we ask you to stay safe, stay healthy, and stay Hillsdale strong when you choose Hillsdale first. Thanks for joining us today.